threesome and the role playing, is that because things get boring?
We just enjoy our fantasies.
I don't know of any other profession that can ask that question and be alright with it. Hey, your husband's dying and panting like a dog into our machine, and by the way, are you happy in your marriage? Very excited to be reacting to House MD Season 2, Episode 15, Clueless. On this channel, we are reacting to all 177 House videos. This will be Episode 62. Let's see if I can get the diagnosis before House does, as a doctor working in London.
You gonna make me hurt you?
Did I hurt you? What happened? Talk to me. My husband can't breathe. He's turning blue.
This patient has to survive, otherwise who's gonna go star in Top Gun Maverick? So why can't he breathe? The fact he's unresponsive as well at the same time could indicate a seizure. The blue lips are a sign that not enough oxygen is getting into blood and the hemoglobin is starting to change color because of it. Many people think that venous blood is blue, but is that true? Anyone who's given blood will tell you that deoxygenated blood actually turns dark red. So how does low oxygen turn your skin blue? Oxygenated blood better absorbs light than deoxygenated blood. Your skin also reflects blue light much more than red light because of its shorter wavelength, thus meaning that deoxygenated blood makes your skin appear more blue. What else could be causing these breathing difficulties though? A life-threatening asthma attack could potentially do it as well, or the fact that he had a sock over his head. I wonder if they'll leave that part out when explaining what happened.
This isn't gonna work.
I'll be out of your hair tomorrow. What's left of it?
My throat got really dry, and then my tongue felt like it was blowing up like a balloon.
What are you doing?
Sex fiend with a swollen tongue.
The last time House had a patient with a swollen tongue, he sawed him in half. Let's hope history doesn't repeat itself, although I think he was hallucinating at the time. The obvious cause for a swollen tongue is allergy. If you get that and swollen lips, then make sure to get tested. But the obvious answer is never the one in House. So what else could it be? Metabolic could be vitamin B or iron deficiencies. Infection could be herpes, candida, or syphilis would be a very interesting cause. There aren't really any degenerative or cancer causes of swollen tongue that I can think of. Autoimmune, especially with the dry mouth, could be a sign of a condition called Sjogren's syndrome. Toxins could be medicines like ACE inhibitors, lithium, or sulfur antibiotics. Too early to tell though, so let's find out more.
They admitted participating in a threesome a few months ago.
$100 as they're as miserable as the next couple.
If he's not happily married, I don't know who could be.
I'll take the bet.
His throat might be fine, his lungs might be messed up. Get more blood, chest CT, and a body plethysmograph.
Whoa, a plethysmograph? That's not an investigation you hear every day. It's done to measure how much air is in your lungs when your muscles are relaxed. You breathe into it, and then as you're breathing in, the mouthpiece closes, but it's still measuring the forces that you generate with the effort of breathing in. What we use more commonly is something called spirometry, which measures the volumes when you're breathing in and out normally, breathing in maximally, or breathing all your air out, like when you're sighing that the leader of the free world just tripped over a flat surface. Checking lung function tests can give you an indication if you have restrictive lung disease, where the problem is either with the expansion of the chest wall or the lungs themselves, or obstructive lung disease, which is a problem with how narrow the airways are. Causes of restrictive lung disease include neuromuscular conditions or scarring of the lung from things like rheumatoid arthritis or idiopathic pulmonary fibrosis. Causes of obstructive lung disease are things like asthma, COPD, or a condition called bronchiectasis. That is worth a diagnostic guess actually. My first will be interstitial fibrosis, as it has so many spicy causes that we could play with. So question for you smart people, what percentage of people have asthma? Answers down below.
It feels like I have to urinate, and then when I try to go,
Pull up your pants. Herpes.
this is impossible. I've been married for 20 years.
Any kids? Any of them take guitar lessons?
My daughter does karate. Why?
Give this to her sensei.
Give this to her sensei? Give this to sensei? Seems like Miyagi is stuck waxing on. If you're in a committed relationship and you get an STI though, does that always mean your partner is cheating? Not necessarily. You see, it's possible that you or your partner got an STI from a previous relationship and you just didn't know about it. Chlamydia, for example, can be a master assassin laying dormant for years and doing damage in the background until it gets unmasked. It reminds me of a case when I saw a 38-year-old female who had new vaginal discharge. We tested her for chlamydia and she was positive but insisted she hadn't cheated. When she told her partner, he got very upset as he was surprisingly still negative for chlamydia. I ended up needing to have a call with them where I was asked to say that she had it for a long time, which I couldn't say. Also, the most likely situation is that someone like Mr. Miyagi decided to try their hand at a different martial art. We can hold back a diagnosis and keep things confidential and anonymous, but twisting the truth is a definite no-go.
The threesome and the role playing, is that because things get boring?
We just enjoy our fantasies.
I don't know of any other profession that can ask that question and be alright with it. Hey, your husband's dying and panting like a dog into our machine, and by the way, are you happy in your marriage? The name's Cameron, licensed to practice, licensed to invade your privacy. But what's interesting here is that they're talking about marriages getting boring, and the wife said that marriages really only fail when people show their true selves. It reminded me of a Japanese saying about the three faces. The idea that everyone has a public face, a private face, and an inner face. The public face is the version that we show to the world, the person we want people to see when they meet us. The private face is for our family and close friends to know, like how I smell after I get back from the gym or deal with arguments. The inner face only you know, and it contains the deepest parts of yourself, some of which you don't even know, like your Jungian shadow. When people move from dating to a serious relationship, if there's a huge mismatch between their public and private selves, then that can cause serious issues. It's like you ordered the tomato soup at a restaurant and were brought a block of tofu. So to be a truly authentic person, there needs to be genuine parts of yourself in the public, private, and inner faces.
This McGrath revealed decreased lung capacity.
And the CT showed lung scarring.
It's definitely interstitial pulmonary fibrosis.
No way, he does have pulmonary fibrosis. The thing is though, yes, it is a diagnosis, but I don't want to celebrate too early, because if either we don't find the cause or there is none, then head sock sales might take a dive. There are so many causes of interstitial lung disease, which basically means lung scarring. Parrots, working with coal, asbestos or silica, smoking, radiation exposures, sarcoidosis, rheumatoid arthritis, the treatment for rheumatoid arthritis, and that's just scratching the surface. No wonder the episode is called Clueless, because without one, Dr. Sherlock over here will need all his brain power. No more early late morning hair dryers, Wilson.
He's a wedding photographer, so I doubt he got exposed to coal dust or asbestos at work.
There's something wrong with his skin.
Make it stop! Make it stop!
Wait. Interstitial lung disease and skin rash with itch. There is a condition that would explain all of it so well, called dermatomyositis. Your body basically attacks itself with antibodies directed to the small blood vessels in your skin and muscle called capillaries. It can also cross-react with the lung tissue, causing scarring. A blood test for the specific antibodies like anti-MI2 or anti-Jo1 could help to diagnose it. The treatments would be with steroids and other immunosuppressive meds. If that is the diagnosis, then he'll be back playing Kama Sutra charades in no time. Now, if you're excited for the endless material this episode gives us, then check out the channel membership. You get priority access to new videos, access to exclusive polls, and to suggest another series and episode for me to react to. The first 30 members have a chance to win a 1-hour one-on-one tutor session with me on a topic of your choice. We've gained 3 members since the last video. We currently have 24 members with just 6 spots left, so press join now to secure your spot. I'll keep working tirelessly to make it worth your while.
Heavy metal toxicity.
He and his wife worked a wedding in Cabo San Lucas last month. A lot of pottery in Mexico is contaminated with lead-based paint.
Search their house, test for mercury and arsenic while you're at it. Was the ant big and red or small and black?
Medium and brown.
Tox screen?
No evidence of lead, mercury, or arsenic.
I have to admit, I needed to look this one up. Guess I missed the entomology lecture at med school. So what is the difference between different kinds of ants and the diseases that they carry? There are loads of different ants, but the most common ones you see I'll discuss here. So first you've got the black garden ant, which doesn't bite or spread disease. Then you've got the red ant that doesn't spread disease but packs a serious sting. And third common ant is the pharaoh ant, which can infect food with all kinds of diseases. That includes typhoid and food poisoning, as well as carrying infection between patients, none of which seem relevant to this patient, as typhoid causes fever, joint aches, a headache, constipation, and tiredness. If there's anything our patient is not, it's tired. I hope we get more clues for the good of the colony.
Ow! Ow!
Sorry.
No, it's not my back, it's my feet.
See anything?
Excruciating pain in the lower extremities.
It's happening again. He's not breathing.
Swelling, airways closing. He's not getting any air.
Oh, something is seriously off with this guy's immune response. Surely this is allergy. It has what we call a relapsing remitting disease pattern, where it gets worse all of a sudden and then he's fine and it gets suddenly worse again. I think he has something called hypersensitivity pneumonitis, which is a type of interstitial lung disease. So I'll refine my first diagnostic guess to that. It's when chronic allergy causes a complex immune reaction leading to lung scarring and allergy in response to a trigger. The question is, what could that trigger be? The usual ones are house dust mites, pollen, cats, nuts, even mold, but these seem to not be very likely. By the way, the type of pain and itch he's getting in the skin, if you ever get a similar thing, I've got a secret hack for it. Menthol cream that is kept in the fridge. We used it for patients when I was on palliative medicine when nothing else could help relieve the itch. It overloads the sensory receptors with signals of mintiness and cold that help relieve it without scratching. Definitely worth a try if you haven't found something else to help with your itch. Always seek medical advice from your doctor for it though, in case there's an underlying cause that needs to be addressed.
His urine has elevated proteins and red blood cells. The symptoms all point to heavy metal poisoning. Yeah, we all get it. Unless you've got proof and can tell me which heavy metal it is, I'm starting treatment for lupus.
Oh man, they're deciding between heavy metal poisoning and lupus. Neither are on my diagnostic guest list. I have to say though, this really doesn't seem like lupus because of the acute onset of symptoms. Heavy metal poisoning definitely seems more likely, but the question is, which one can cause what we're seeing? Before we go into that, how can we get heavy metal poisoning besides listening to too much Down with the Sickness? There are metal particles in so many things that we come into contact with and even eat, like mercury can accumulate in tuna over time, which can transfer to a person if they eat too much, but that is over 25 tins of tuna a week. Another way is drinking water from old lead supply systems, or working with metals on the job, like from old paint or pesticides. Children tend to be at higher risk because they can develop toxicity with smaller levels of the metal and tend to be a little less risk averse. Now we know the tests were negative for lead, mercury and arsenic, so what else could it be? My third and final guess could be cobalt lung, as that can cause lung scarring as well as skin irritation and nerve defects. The treatment would be to remove the source. Maybe if this relationship is so adventurous, then he's broken a bone in a previous relationship which needed a metal fixation device that caused the cobalt poisoning. That would be an insane call if it's right. Interestingly, cobalt itself is usually an antidote for cyanide poisoning, as it forms a stable compound when they come together. There is an experimental drug called astaxanthin that could help if it is cobalt, so let's find out.
It's Mrs. Lambert's herpes test results.
Of course, maybe it was the wife. Maybe she was the one who...
You think she's poisoning him?
The only way we're gonna find out what she's been sprinkling on his cornflakes is to search her.
You satisfied?
She agreed to let me search everywhere else, but this she says no to. Doesn't that tell you something?
Yes, that she doesn't want some lunatic doctor searching her vagina with a flashlight.
Searching her vagina with a flashlight? I thought I was watching House, not Orange is the New Black. This case reminds me of the story of Lana Clayton, South Carolina nurse who found her husband at the bottom of the stairs with his heart stopped. As it was a sudden unexplained death, an autopsy was performed which ruled the death as a heart attack. But the man's nephew, who happened to be a police officer, had his suspicions as Lana hadn't mentioned trying to revive her husband, even being a nurse. That triggered a toxicology panel which checks for over 10,000 compounds and can be back within 24 hours. That showed up an obscure drug called tetrahydrozoline that turned the investigation on its head, more than a gymnast on a bungee jump. There were a few other things though that made Nick suspicious and triggered the toxicology investigation. He went up to the bedroom and noticed the mattress was drenched in urine. When confronting Lana, she mentioned that he does that when he gets vertigo. Nick was a bit suspicious about that, and shortly after she demanded that everyone leave. She scheduled a cremation for the next day. The alarm bells were going on overdrive at this point as another nephew, Chris, along with Nick, insisted on that toxicology report. It also didn't help that Lana accidentally shot Steve with a crossbow 2 years before this. You see, the tetrahydrozoline that was found is an ingredient to an eye drop called Vicine that is massively toxic in overdose. It can cause nausea, vomiting, dizziness, and with a whole bottle can stop breathing and take a life. It's colorless, odorless, and tasteless, but how did they know it was her? You see, as soon as they mentioned the name of the chemical found, she said, "Oh yeah, that's his Vicine. He puts 2 drops in his coffee every morning to help him go to sleep, and had been doing that for a few years." Then when pushed, she started suggesting he may have overdosed on it intentionally to end his own life. After some pushing, she cracked and admitted it, saying she just wanted him to suffer. They then found that she burned his will. He had millions of dollars in it. She then tried to end her own life the day after confessing by taking pills and switching on the gas with no ignition, but was caught before she could complete it. Was then charged with voluntary manslaughter in 2018 and is now serving 25 years in prison. More money, more problems.
I'm not giving you permission to assault someone.
Call the code!
Bob, talk to me. Bob, honey, please.
There's got to be some way to prove that it's him.
Either of you two ever sit on a public toilet?
I always use a paper cover.
I never knew.
He could believe that you can get herpes from a toilet seat, or he could be cheating on you and just be happy to have an out.
The way he looked at the ring in the end there was kind of suspicious. Could it be that the patient's wedding ring is triggering an allergy? Surely they would notice, as it would cause localized skin reaction before blowing up his tongue and his lungs. Common coatings are things like gold, chromium, and cobalt and nickel. Maybe the wife dipped it in something a little spicier though to plan an escape route. He always seems to get worse when it's just her and him left in the room together. Coincidence? I think not. Actually, the patient's immune system is destroyed, and we know that gold in a ring is an immunosuppressant. What if the wife has been sprinkling gold on his food? Oh, can I take away my cobalt theory and switch it for that instead? Maybe not, but I'll be so upset if it's that now.
Do another heavy metal screen, only this time test for gold. Don't let her go to the bathroom. When I was a kid, my dad was stationed at a Marine base in Egypt, but I did learn a fair amount about the ancient Egyptians. For example, they discovered that stannous chloride is not only great for toughening ruby glass, but if it's mixed with gold, it turns bright purple.
This episode has tested House's knowledge of ants, clay pots, and now alchemy. Well, at least we avoided the gynecology test, even though he's standing in the women's bathroom. I admit I had to look this up again, but stannous chloride is also known as tin chloride, and it takes an electron from gold, reducing it and causing it to turn purple. So he didn't want her to go to the bathroom and wash her hands because that would get rid of the evidence. Although most people don't wash their hands anywhere near well enough to do that. You see, when we first started med school, we did this experiment where fluorescent dust is put on our hands and then we're asked to wash it off. Even when you're conscious of it, when the UV light comes in afterwards, then the finger creases and back of the fingers light up like a beard bauble from all the dust. Well, hopefully it's the dust. Now, if she's guilty, then show me those avatar hands.
It's almost poetic.
Heavy metal toxicity for gold was off the chart.
The only thing he did wrong was marry a sociopath.
He's gonna need a lung transplant.
I can't believe that it was actually the gold. Just too late. I love how Chase has gone from, if he isn't happy in his marriage, then I don't know who would be, to The only thing he did wrong was marry a sociopath. I feel like I might need 4 diagnostic guesses now. Amazing ride either way. 8 out of 10 entertainment, 6 out of 10 accuracy because all the sudden recurrent tongue swelling wouldn't quite happen with gold poisoning, and 9 out of 10 diagnosis for the added poetic value for sure. This episode is great, but it doesn't make full sense until you watch the previous one where House keeps a patient on life support against her husband's consent here.